So let's imagine that you have a client with limited passive and active hip flexion range of motion. They have pain through the anterior hip and they lack the ability to forwardly rotate the pelvis over top the femur in standing. So which one of these two exercises might you choose first in order to promote greater hip flexion range of motion? So this first exercise is a 3-point kneeling variation where we are encouraging a forward rotation of the pelvis over top the femur and gradually flexing the hip via the femur and loading the hip extensors at length as we move through that hip flexion via the femur. And the second is a standing hinge variation where we are maintaining femoral position and dynamically rotating the pelvis over top the femur to get length into the hip extensors. Okay, so regarding today's post, we just wanted to explore the clinical reasoning that people might have when it comes to expanding range of motion. So our approach would be, if the intention is to expand range of motion and not necessarily to train muscles and joints through their available range of motion, then we would want to be able to organize muscles and joints in a way to constrain that motion and constrain that load and force to the target tissue and to the target joint. So in exercise number 1, I showed a very fast transition into hip flexion just for the sake of time on the video, but naturally with a client who has a pain experience, some sensitivity, some limitation in range of motion, we would want to gradually expose that hip to more flexion via the femur. So in that video, we have pre-positioned the pelvis into a forward rotation relative to the downside femur. And we are rocking back to the point where the femur is the segment that is moving, okay, or that is expressing the dominant motion, okay. That gives us the opportunity then to build force into the ground via the knee, or via the outside of the knee, because we have that femur in a position of external rotation. That allows us then to concentrate that demand into the hip extensors because we're not getting contribution from the knee extensors, the quads, or the ankle extensors, the plantar flexors. Okay, so it allows us to really constrain that demand into the hip and target hip flexion range of motion in a very gradual manner. In number 2, there is a higher coordinated demand. And with a higher coordinated demand, there's greater likelihood that force and motion will be shielded away from or avoided from where you want it to go. So for us, it would reflect a strategy that we could use to train the hip extensors through their available range of motion, okay, via the pelvis rotating over the femur with the added mass of the trunk, with extra coordinated demand. So fundamentally, it's all based on your intention and what you're trying to achieve with that task.